I would like to introduce the dental professionals panel discussion. We have several dental panelists, and they're going to offer you interview tips. And also they're going to provide to you how to manage your time while you're in residency. They have a lot of, key tips and information that is definitely going to benefit you, especially if you're in your fourth year, you're waiting for, residence programs to hear back from. So we're going to start with some introductions. I'm going to start with Dr. Vinson. If you could give us a brief introduction of your name, birthplace, your dental school alma mater, and your current program.
Hello, everyone. My name is Dr. Laurel Martinez. I am from Philadelphia, Pennsylvania. I went to Virginia Commonwealth University School of Dentistry, graduated 2020. And then I went to Albert Einstein General Practice Residency. It's also in Philadelphia, Pennsylvania. Fun fact, I was born at that hospital. I did not even know that they had a residency for dentists. And it turns out it was a great residency. And I just graduated from that residency, and I'm currently in private practice. Thank you for having me.
Thank you, Dr. Vincent, for taking the time out. Next up, Dr. Martinez.
Hi, guys. Good morning. Laurel Martinez. I was born in Los Angeles, California, and I went to Harvard for dental school. I graduated in 2020, and then I got to come back, and I'm at UCLA for endodontics now. And thank you all for having me.
Thank you, Dr. Martinez. Up next, Dr. Talalenko.
Hello, everyone. My name is Dr. Anastasia. I apologize for any background noise. Currently, I am at Stony Brook as an endodontic resident. I'm in my first year, and I'm originally from Naples, Florida. Thank you very much for having me today.
Thank you for being here. Next up, Dr. King.
Hi, I'm Erica King. I grew up in Americus, Georgia. I went to Meharry Medical College, School of Dentistry, finished in 2014, and then I did a 1-year GPR up in New York at Harlem Hospital Center. I worked for 4 years as a general dentist before going back to complete a pediatric dental residency at Harlem Hospital Center again. And so I just finished in May, and now I'm back down in the Fort Lauderdale area.
Thank you, Dr. King. Meharry in the house. I had to just say
sir.
that. Next up, Dr. Scott. Are you on, Dr. Scott?
Yeah. Hey, everybody. How you doing? My name is Kerwin Scott. I'm a graduate, a 2020 graduate of Meharry Medical College. I'm currently doing a 3-year residency in periodontics at the University of Florida. I'm originally from Milwaukee, Wisconsin. I've done a lot of different things, military, I have a family. So if you have any questions about anything, I'm open and you can ask me.
Thank you, Dr. Scott. Appreciate you for being here. Next up, Dr. Wilkerson, all Meharry.
All Meharry. Hello, everyone. My name is Corinthia Wilkerson. I graduated from Meharry this past year, actually, 2021, and I'm currently studying periodontics at Harvard School of Dental Medicine. So this process of residency is extremely fresh for me, and so if you have any questions, feel free to reach out as well.
Thank you, Dr. Wilkerson. Thank you for being here. Next up, Dr. Gallagher.
Hey, you guys, I'm Brendan, graduated from Stony Brook Dental School, currently a first year out of the 4-year program at NYU, oral surgery. Shareem, thank you so much for putting this together.
Oh, you're welcome. Thank you for tuning in and contributing. I really appreciate it. Next up, Dr. Carter.
Good afternoon, everyone. My name is Ken Carter. I'm originally from Chicago, Illinois. I also went to Meharry Medical College, class of 2020. So shout out to my classmate, Dr. Scott. I'm currently at the University of Michigan studying orthodontics. And thank you guys for having me today.
Thank you, Dr. Carter, for being with us today. Next up, Dr. Czar.
Hey, everyone. I'm Sean, first year ortho resident at Stony Brook, classmates with Brendan, co-resident also with Dr. Anastasia. Thank you all for having me.
Thank you, Dr. Czar. And last up, we have Dr. Thompson.
Good morning, everyone, or good afternoon. My name is Brandon Thompson. I'm from Detroit, Michigan. I also went to Meharry Medical College. Shout out to Corinthia Wilkerson, my classmate. I go to Howard University for orthodontics, and it's a 2-year program. So thank you.
All right, thank you, Dr. Thompson. And so this portion of the panel discussion, we're gonna jump into the questions. And Dr. Thompson, you're gonna take over. We're doing a snake orientation as far as the order. And so my question for you, and then you go down the line, answer the same question, is, let's see, what question can we come up with that is real good? I would say, what goes into the selection criteria of a matriculating candidate at your program? Like, you know, the ones that get in, what did they have? What went into that?
I think of course, good grades is going to start with that. But what they're really looking for is someone who's professional, who dresses well, who's groomed. You know, as you can tell, my hair is kind of twisted, but at the time, my hair was a little bit shorter, and I would wear something at night to make it seem a little bit lower because it was via Zoom. So just wanted to make sure it was very professional. They want individuals that are confident. I think that goes without saying. And those that are involved in extracurriculars outside of the classroom, whether it's organizations or volunteering, different things like that.
Is there anything particular about Howard that it was, you know, specific and not general across the board?
I don't think so. To be honest, our interview was quite quick. It was via Zoom. So I don't really know if I can't really speak on behalf of my co-residents, but it was pretty general for mine anyway.
All right, thank you very much. Up next, Dr. Czar.
Yeah, so I think that when applicants start, the first thing they look at, of course, is grades, and you know they'll look at research. But in terms of Stony Brook, I know that they weigh heavily on in the interview how personable you are, how they see you fit with our co-residents, because we do match up with our co-residents. We do match up with a third year and a first year, and we do spend a lot of time together, and they help us. You know, we learn from each other. We spend a lot of time together. So once you have the interview, we know in terms of academically, you're there. Now it's just a matter of, do we match together? And that goes both ways, not just you to the program, but the program to you. You know, our program that might not be what's best for you. So, you know, it doesn't always have to be a personal thing, but we do look to see, you know, personality wise, do we match up together? And that's something that I feel is very important for us.
Dr. Carter?
I definitely have to ditto everything that Dr. Czar just said, actually. I think that aligns very well with what the University of Michigan looks for as well. I think to give little tidbits or maybe things that are not as obvious, our program definitely does value public speaking. There's a huge initiative and effort pushed toward presentations. At the University of Michigan, you'll give something north of 30 presentations across your time, and that'll be to other residents in the orthodontic department, other residents in the grad departments of dentistry in general, and at conferences. So public speaking is something that they definitely value. And in addition to that, I know for you guys that don't know, you take the GRE for many of the orthodontic residency programs across this country. The main area that I've seen that Michigan pays attention to, the idea is to do well on all three portions, the quantitative, the verbal, and the written portion of it, but Michigan does put special emphasis on the written portion because it's a research-driven institution. So the written portion gives them some indication of your ability to create and generate and then write a thesis.
Thank you, Dr. Carter. Up next, Dr. Gallagher.
Hey guys, so oral surgery residencies are similar in a sense and different in a sense in what they look for. From what I could pick up on my interview trail was there's a little bit of a difference between the 4-year and the 6-year. So I'll try my best to answer both. First first and foremost, obviously, I think for most residencies, they want to see a good class rank, right? You know, they don't want to see that you're last in the class. So keeping a high class rank, you don't have to necessarily be number one. They want to see you having a strong class ranking, a good GPA, and obviously a good personality, right? The next thing on the list is the CBSE, is the Comprehensive Basic Science Examination. That is probably the number one weed out score. It's an exam of 200 questions that they test you, similar questions to the medical school step 1 board exam. They weed you out based on that score. You want to try to get at least a 70 to 75. It's becoming relative since the score is so competitive. That's a big thing. They want to see a good score on that examination. And in the 6-year residency, they rely on that more heavily. The 4-year residency, they don't. Obviously, they want a good score. They don't rely on that as heavily from what I saw in my interviews. The last thing that's also very different is while some residencies have externships, the oral surgery externship experience is a full week to sometimes 2 weeks long. And this is how they get to meet you, see what you're like. They kind of get to see how much clinical experience you've had, how much understanding you have of the field of oral surgery itself. You get to shadow run all the residents. You meet the program directors. Some of them will give you an exit interview, which basically they want to know, what did you like about our program? What did you like about the externship? What did they see here that you didn't see at other externships? What did you see at other externships that you'd like to see our program implement? This is a good way for them to assess what kind of personality you are, in a lot of ways, what kind of character you have.
Thank you for that, Dr. Gallagher. Next up, Dr. Wilkerson.
Yes, so similar to what everyone else has said, my program is looking for someone that can be a team player, somebody that's self-motivated, somebody that understands dentistry and can be empathetic towards patients and really loves the field, especially perio. However, they also want to know that you can fit into the environment and that they're going to also be a great match for you. You spend 3 years with a small group of people and it's a lot of time. And so you want to be able to enjoy the people that you're around and be around people that can have the same personality as you. And they also like to have leaders in the program. They don't want someone that's just solely focused on research, someone that's just solely focused on academics. You have to be well-rounded and be involved in multiple things and community efforts. And so just a well-rounded individual that's going to uplift the program and continue to be great and allow the program to add to who they are and not make the program who they are.
That's great advice, Dr. Wilkerson. Thank you for that. Next up, Dr. Scott.
Hey, everybody. There's so much, but I would say that they do like people who show interest in the specialty before you actually get there, like externships. I know for my program, I did a 1 week externship there. Of course, you want to do as good as you can grade wise while you're in dental school. You want to have as much research as possible, a lot of community service. You really, to me, it really all boils down to, how mature you are. Are you the type of person, are they going to have to hold your hand and pull you along throughout the residency? Because you get a lot of the learning, a lot of the procedures that you're going to do, you're going to be doing by yourself. So you have to show up with something. You can't just show up and not be prepared. You won't be successful. So they really look for maturity. They look for individuals who can fit in. At times it can be a tough environment. It can be stressful. I mean, some of the things that we do, can be invasive, especially if you're not really familiar with the procedure. So, you still have to be able to draw from some type of inner confidence. You don't have to be, a Superman, but you definitely need to, be able to believe in your abilities, but at the same time, still be teachable. So I think self-belief, maturity, the ability to learn and work with others and to be teachable, I think will go a long way when applying to a perio program and UF specifically.
Thank you for that, Dr. Scott. Next up, we have Dr. King, Pediatrics.
Yes. So along with what everybody else said, you want to make sure that you're a good, well-rounded candidate with good character. So on top of your academics, you want to make sure that you've completed your dental curriculum or that you're on track to complete it. You want to have experience with research. You want your extracurricular activities to show that you do have an interest in the pediatric population. You want a good attitude, to be a team player, and most of all, you want to be teachable, because when you're there to learn, and your attendings are going to want to know that they can teach you, that you have a humble personality. You could take constructive criticism well to better yourself. And so your recommendation letters and how well your professors in school write for you will make a difference, and your personal statement can also tell your story. So a little bit of everything that everybody said.
Thank you for that, Dr. King. And I hope my peds people are on here. Peds, members of the school, they have a lot of interest. Peds, Dr. King, she's been in this field for a few years. So, well, she just graduated, but she's been working as
You can feel free to reach out. I've had experience with the general practice residency as well as working as a general dentist, and then on back to the pediatric dental specialty. So I can help you with any of those areas if they apply to you.
Thank you, Dr. King. Up next, Dr. Talalenko.
Yeah, so as far as when you first apply and when they're looking at a blank screen and just, no visual image, just the application, I would say what they're first filtering is grades. They're not looking for the top of the class, but they are looking for someone, that did well in school, did a lot of extracurricular activities. As far as who gets an interview, they definitely look at personal statement. They want to make sure that you're going into something that you are 100% want to do for the rest of your career. And they 100% look at letters of recommendation. So make sure that you are asking someone to write you a letter that is familiar with you, that can write you a really strong recommendation letter. And then once you're finally get an interview, as far as the interview, they're just really looking for someone that's personable, someone that will fit well, not only with the program directors and the faculty, but they're also looking for someone that will fit well into that specific program, go along well with the other residents and other residents in the other departments. So that's what I feel like. There's a little process, but that's what really sticks out is grades first, then your letters of recommendation as far as who gets an interview, and then finally just being a well-rounded person during the interview and very personable.
Thank you for that, Dr. Talalenko. It seems a lot of similar just patterns there as far as especially getting along with the co-residents, and they want to get along with you. So that is
that's very important. Yeah, it's very important.
All right, up next, Dr. Martinez.
Okay, so for endodontics at UCLA particularly, I think very similar to what Dr. Scott said, the maturity and working hard and perseverance will be number one. Even I came straight from dental school to the program, but these are tough root canal cases. It's not what you'll get in dental school. So you just have to be, I think the program director realizes people who are going to be able to work hard and kind of get thrown into the fire at sometimes about really hard cases. But as long as you're, teachable and willing to practice on extracted teeth as many hours as it takes to get good at what you want to do, then she's totally fine with people coming straight from dental school, and also people coming from a few years out of in private practice. Sometimes they think that they know a lot of the things, but you have to be able to be coachable and do the things that they want to teach as well. So I think those are the top, few qualities and characteristics of people to get into this program, are usually just really perseverance and hardworking and able to be taught.
All right, last person for the question, Dr. Benson.
In terms of a general practice residency or advanced education general dentistry residency, you're looking at qualities such as being a team player, someone who's honest and has integrity. You're looking at someone who is teachable, and someone who can actually benefit from being in the program. Because sometimes if you're not technically going to benefit from being in a 1-year program, if you're not really going to put your all into it, is really kind of pointless. Someone who's actually really reliable, You're going to be there when you're asked to be there. You're going to come in on time. When you're on call, you're actually going to answer the call, things like that. And I know it sounds silly, but you'd be surprised. And kind of what everyone else has been saying so far, some truths for every residency, well-rounded and ability to self-assess.
Thank you for that, Dr. Vincent. And we're going to head to the next question. You're going to start it off, Dr. Vincent. And so I'm sure many of our viewers would like to know, what is at least one question that many interviewers for your postgraduate programs, they fail to answer successfully, or they have a problem just addressing? Dr. Vincent?
I'm sorry, can you say it one more time?
Yeah, so pretty much I was asking, what is one question that interviewers fail to answer successfully during their interview, residency interview?
One question that they failed to answer successfully. So I haven't seen too many interviews, but sometimes when they're asked about personal experiences, or when they're caught off guard to talk about random things more about themselves, I think they're not always prepared to talk or discuss about that. And I think sometimes when we're in dental school, we kind of lose, that kind of work-life balance, because we're so focused on dental school and being successful. And so I would say, even though you may have a little bit more, or a little bit, a little bit more of a challenge in finding that work-life balance, definitely tap into the things that you like, so you can be a little bit more personable, because you still have a personality and you still want to convey that to the people who are interviewing you as a candidate. And you still, when you get to clinic, you want to come off as a personable provider to your patients as well. And so that's something you want to portray.
Thank you for that. Dr. Martinez, one question interviewers failed to answer successfully.
I think for endodontics, a common one is when people are asked, like, why do you want to do endodontics? A lot of times the people just say, I like getting people out of pain. I like that part about the job. And I think doing root canals is more than just that. Like, I think that's a good starting point, but to be able to, answer the question successfully and why you want to commit your life to doing endodontics is more than just the good part about getting people out of pain, because there's a lot of other complications and different challenges that we face for doing root canals. So I think as long as you can lead back to why you really want to study endodontics, then that's the goal. You don't want to just say it's because of you like that part about the job.
Thank you so much for that. Dr. Talalenko, one question.
Based off of what Dr. Martinez said, same thing. I think the most important question is why you want to go into that profession. And in endodontics, that's the most important question during the interview. They just want to make sure that you're going into a profession that you are 100% passionate about. And if you don't answer, if your answer doesn't convey that passion, they kind of understand that you're not 100% into the specialty. So it is really important to have that passion when you're talking about it in your personal statement, as well as during your interview.
Thank you, Dr. Talalenko. Dr. King, one question.
With pediatrics and with the interview experiences we've had, I don't know that there's really a wrong answer that you're giving, but the one thing that you want to do is make sure that you're always engaging. And so if they ask you if you have any questions, or if they ask you anything that's open-ended, you want to make sure that you respond, you reply, you have questions, you show interest. Like, why do you want to come to this program? Why do you want to do pediatrics? Like, make sure that you respond and always have a question or something engaging to talk about with them, other than just no, nothing at all. Like, be engaging so that they remember you.
All right, thank you for that. So we can pivot on that, actually, not just because you said it's not necessarily what you say is wrong, but it could be what you do as well. So we could throw that in the mix. It could either be what someone doesn't do that doesn't give them a good, image in the light of the program directors, or we can go into actual question that they ask. So now we have Dr. Scott up.
I would say first, just be honest, be yourself. I know, for interviews, you want to prepare, so you sit down and you come up with all these questions that they might ask you. You call around to everybody. What they ask you, if you applying for a specialty, you obviously know how to study and gather information and do all this stuff. So, you might ask 10 people, whoever, the response that you got the most of, that might be one of the questions that you prepare for, but then you get into situations where, they may not ask you the question in that way, or things might pivot. The best way to be is honest, because, it's not only you, hoping that they pick you, they're hoping that you pick them. It's this, I don't care what program it is, how the prestige of the program, they need you just like you need them. Because, when you go to these meetings at the end of the fiscal year, what do they talk about? They don't talk about the personalities of the residents. They talk about how much money they made in the clinic. So these are things that that I will keep in the back of my head. And secondly, I think the question that people mess up on all the time, or maybe not answer as successfully as they might want to, is weakness. I think to me, it's when somebody asks me what my weakness is, they're really asking me, when was there a time where I had some adversity and how did I get through it? For me to just say, oh, I got a D one time in dental school. Okay, you got a D. That's the bad part, but what did you do to fix it? And I think weakness can really be, if you answer it correctly and really are honest and aggressive about answering the question, I think that you could really turn that into a positive.
That was great advice. I try to incorporate that into my daily lifestyle as well. But great advice. Thank you for that, Dr. Scott. Next, we have Dr. Wilkerson. One question or one answer that they don't answer successfully.
Yes. One of the questions is, tell me about yourself. A lot of times candidates will spend 15 minutes trying to tell the program director and the interviewers about themselves, and 15 minutes is too long. You need to have a good sense of who you are and answer that question as concisely and precisely as you can, and allow the rest of the questions throughout the interview give you the opportunity to show your personality. But when they ask you, okay, tell me about yourself, that is your time to put on your best confident face and tell them exactly who you are and be sure of yourself, and let them know, like, hey, I am meant to be in this program, and this is who I am, and this is who you're getting. And the rest of the interview, you are going to be reminded of this confident person sitting directly in front of you or on this Zoom screen. But that's one question that so many people mess up on, because they are looked at as if they're trying to prove why they should be in the program and not just simply telling the interviewers who they really are.
Thank you, Dr. Wilkerson. Are you a motivational speaker on the side too as well?
No, I'm not. To my friends, yes, but publicly, no.
Okay, that was some great advice.
Thank you.
Next up, Dr. Gallagher.
Dr. Wilkerson said that so well. I mean, that was spot on. And since we're on that topic, tell me a little something about yourself is probably the most commonly asked interview question, not just but I would say probably for most residencies. The other three that I noticed were, tell me, like, why do you want to go into oral surgery or this field, for example? Why our program? And then tell me some of your strengths, and then tell me some of your weaknesses. So just give you something to be prepared for. Answering these questions, I don't think are something you could really prepare for. It's more like write down several bullets about what you want to hit and what you want to get across about yourself, and then explain them and why it applies to why you're a good fit to that. It's explaining that indirectly. You don't want to come prepared for interviews based on like, oh my God, are they going to ask me about this radiograph picture? Like, what diagnosis is this? No, like, I did research in dental school. Not one of my interviewers asked me about that. But 6 of them asked me about playing the violin. Just like I put that on the resume, and that's what they asked about. So I think the lesson we learned here is put as much about you out there as possible. And to answer the question, Shreen, is it something that you have or didn't do that really gets you into the program or not? No, I really think it's about how well you vibe and how well you converse with the interviewer themselves.
Thank you for that, Dr. Gallagher. Dr. Carter?
Yeah, no, agreed. I think they have pretty much did a great job thus far summing up some of the things that you want to pay attention to, are things that often or can be challenging to answer or do along the interview trail. I think Dr. Wilkerson made a good point about being succinct and efficient in the answer to your question of tell me about yourself, and also to recognize the tools that you have as an interviewee in those situations. Oftentimes, if you have a clear understanding of how you want to answer that question and you have your elevator pitch prepared, you can guide the narrative or the direction of the interview with that as well. If you end that statement with something that you're interested in talking about, they can receive that. And a lot of times that directs them on what their next question will be. So take control where you can in these interviews, because you have a lot more of it than you think you do. But for my own personal one that stumped me actually, and I took note of this after my first interview, was tell me something that's not in your application. We spend so much time investing everything that we have into building these personal statements, applications to be as conclusive, inclusive, and comprehensive as possible. And then you get there and everything about you is on that paper. So there are things that they didn't need to interview about because they already have access to it in your documentation. So you want to keep some things up your sleeve too. I think you want to obviously build a sound application as an applicant, get to these programs and have things that make you or be able to talk about things that makes your journey different or that makes you stand out as a candidate. For example, Dr. Gallagher was just speaking about him being a violinist. Those are things that are interesting to people. So if you can keep some of that stuff in the tank as well, try to have at least 1 or 2 things that aren't on your application, because you may get hit with that question.
Thank you, Dr. Carter. What I take from that is don't show all your cards. It's like a poker game. But up next, Dr. Zar.
Everybody really got through every single question. So I think something that also stumped me was the opposite of Dr. Scott, was what is some of your strengths? And I think it just could be hard to explain what your strengths are without trying to feel like you're showing off or you're being cocky or pompous in a way. But this is, when you're in the interview, this is your time to shine. This is your time to explain to them who you are and what your strengths are. So don't be hesitant to explain that. And I think Brendan's, method of laying out a few bullet points, just so it doesn't come off rehearsed. You don't want to sound like you've memorized an answer to some of these questions that, we anticipate will come, but just so that you can, casually go through some important points you want to hit, especially when it comes to your strengths.
Thank you for that, Dr. Zar. Dr. Thompson?
Man, most of the questions have already been kind of said. Definitely want to echo the strengths and weaknesses. But one thing I think that needs to be said is talking about the research, because I got that question a lot. They'll ask, well, tell me about your research. And if you're not well versed and if you don't really know the ins and outs of it, you could be at a loss. So I think that's definitely a very important one.
Thank you very much for that. I hear that all the time. Anytime you have something on your resume, you make sure you know it in and out, because, they can ask you about it. And if you, drop the ball on that, it's going to make it look like you didn't know what you were talking about or you didn't actually do the research. So definitely know what's on your resume, CV, verbatim, in and out. So next question we're going to ask. We're going to switch to our managing residencies. Of course, we're up for time pretty soon. We want to give the viewers a chance to ask some questions. But with regards to managing residency, we're going to ask, what is a typical clinical work week for a resident in your particular specialty or field? And how do residents maintain a work-life balance? And you, Dr. Thompson, you're up.
Oh, okay. So typical day is about 9 to 5. About 4 of those hours were in clinic, and the other 4 were in class. So it's really not that horrible. Studying outside the clinic, though, I definitely want to make sure that everyone reads the articles, especially those that are going into orthodontics. I'm sure periodontics and oral surgery are the same way, but there's so many articles that you need to do, and you need to focus because they're not going to hold your hand like they kind of did in dental school and just give you PowerPoints. They're going to expect you to read and understand the material because they're just going to keep going. So that's my take on that.
Thank you, Dr. Thompson. Dr. Czar, have any words for us?
Of course. So our schedule as a first year resident, 8 to 10 every day, we have case conference where a resident presents a patient and comes up with a treatment plan, and our faculty and our co-residents, we sit, we discuss the treatment plan and discuss the case. If we agree, we disagree, if there are alternative options. At 10 o'clock, we go into clinic until 1 hour for lunch, and then 2 to 5, we're back in clinic. At the end of the day, as a first year resident, we're paired with a third year. So we, when I have my patients, me and my third year, we sit together and we go over a case together. We discuss treatment plan options, and, we run through the case, and that can go until about 8 o'clock. And definitely to Dr. Thompson's point, this is not like dental school. This is also, this is your specialty. You're going to decide how you want to be as a clinician. So especially in the field of ortho, there's a lot of reading to do because we didn't learn so much about it in dental school. So there's a lot of reading afterwards because you want to be prepared when you go to clinic. You want to make sure you're, well-versed on all these concepts that are coming at you. So the day it's a full day. It can go up some days till 12:30, 1 o'clock, catching up. But the more you read, the more ahead of the game you are now, the easier it's going to be for you later on.
Thank you for Dr. Czar. Lifetime learners. That is emphasized so much. So next is Dr. Carter.
Yes. So I'm a second year ortho. So my schedule looks kind of similar to Dr. Czar and Dr. Thompson. So essentially, they have it set up here to where the saying is you're a student in the morning, you're a clinician in the afternoon, and you're a researcher at night. So our mornings, 8 to 12, usually consist of classes, which are, they're amongst the different ortho residents first to third year, as well as with other grad level dental students as well, so like perio, oral maxillofacial surgery, and things of that nature. Then after that, we get an hour break for lunch, and then the afternoon is clinic time. So you're in the clinic from 1 until 5. Then following that time is when we have to work on fabricating appliances. There's a certain amount of orthodontic appliances that you have to make here at Michigan in order to matriculate out of the program, as well as start to build your thesis, because at the end, we have to defend a thesis in order to be awarded our master degree in orthodontics. So that paired with the literature that you have to definitely stay up to date on in order to be a comprehensive clinician, as Dr. Czar said, there's a lot of articles to read, and the advancement in orthodontics, as I'm sure it is with every other specialty, is constant. So we got to realize that you're going into an industry like it's been aforementioned, and you're going into a level of your profession where you are the end game for a lot of people. You are the specialist. There's nobody else to send to after the patient is sent to you. So you have to take pride in that and in your craft. And as a result, you have to be as comprehensive as possible and stand up to date. So there's a lot of literature that constantly has to be reviewed. And as Dr. Czar said, that sometimes can take you until late into the night, but this is your craft. So the work-life balance thing, Shareem, is actually something I'm still working on. So I can't really answer too much to that, but it's a lot, but it's manageable. I mean, we're here. You see all of us here. So
Exactly. We'll get through it at some point. Fingers crossed. Thank you for that, Dr. Carter. Dr. Gallagher, typical clinical work week and work-life balance.
So a little bit different. It's a little different. And I'm also off service. Right now I'm on anesthesia rotation. So I'll give a little bit of that. But as far as on service, when I'm an oral surgery resident doing the work there, It's at the end of the day, most days I pass out. You start between 4 and 5:30 waking up, and then you go into the clinic. And the first thing is you gather with the other residents that are also currently on service, because everyone's like, some people are in medical school, some people are on anesthesia, some people are on general surgery. So then you gather up all the residents that are on service, right? Typical gatherings occur between 5 and 7. It's very variable based on how many inpatients you have that are admitted into the hospital, right? These are patients that have gotten a mandibular fracture, have gotten a massive infection, Ludwig angina or something, right? Or have cancer that needs to be taken out, right? So then it could be anywhere between an hour and a half. It could be as quick as 15 minutes. You only have a couple patients to see, but sometimes you might have to round in multiple hospitals. We might be staying in Bellevue. We might have to go a couple blocks up to NYU Langone to see the patients over there. Then we come back, usually between 7 and 8, and now we start to prepare the chief residents and the upper level residents for their OR cases. So we go back into the hospital OR setting, not the room setting. We set up the rooms. We make sure their gloves, they have all the instruments ready to go. The nurses are set up. The consent forms are signed. The COVID tests are in, et cetera, right? Then we come back to the regular oral surgery clinic setting. We go to the resident room. We look through the cases, prepare for the day. And then between 8 all the way through the day to about 5, you're in the clinic. You're pulling out teeth. You're putting in bone grafts. You're putting in implants. You're taking on consults to get the next step for their surgery. Now, at the end of the day, between 4 and 6, usually around 5, right? Now you get everyone back together. Now you have to round again. How did everyone make it through the day? How are their calcium levels? How's their potassium? Are they healing? Did the swelling go down? Do you still have a fever? Et cetera, et cetera. And now if you're on call, the entire day you had a pager or 2 on your hip. So you're getting paged throughout the day. Like, hey, doc, can you come take a look? We get a consult. He's about to go into cardiac surgery. Can you see if he's cleared for that? Like if they have any teeth that are diseased, they need to be taken out before that. Because as we know, the heart surgery and thereafter can be affected by diseased teeth in their mouth. If you're on call, you have to stay there throughout the night. Or if you live close by, you could go home. I won't bore you with those details. When you're off service, such as right now, I'm on anesthesia. I get up between 5 and 6. I go in about 6:30. I get out by 4 or 5 every day, and I have no call for 6 months. So right now, I'm like, it's a really good feeling. So I'm happy to be here.
Thank you for that, Dr. Gallagher. Make sure you enjoy your time, because I'm sure it won't be like this all the time. So next up, Dr. Wilkerson.
Yes, so for my program, the first years we undergo a 6-week summer session. And during that summer session, we are in class every day, Monday through Friday, from 7 to 7. And during that time period, we're going through the Carranza's textbook, which is Carranza's Clinical Periodontology. And we don't get lectured to, but instead we have a flipped classroom model where we have to prepare lectures based off of the chapters. And so we went through every single chapter in the book, and it's 4 of us in my program, so we each had 15 chapters to prepare and present on. And in addition to that, you're getting all of your trainings done, ACLS, BLS, going through an IV sedation course at that time. And then we started transitioning to the other perio courses that we take with the rest of the residents. So now that we've entered into the fall semester, my schedule is still 7 to 7 on some days. We're also taking master's courses because we have to get a master's degree with our residency degree. So I take immunology and microbiology again. I had to take gross anatomy again. We're taking foundations of the dental practitioner. Every Monday evening from 5 to 7, we have treatment planning seminar. And so one resident, in my department, they prepare a presentation that gives us basically a snapshot of the patients and what the treatment options that they have come up with. And then we also consult with the pros department, endo, and the chairs of those departments and get various feedbacks from them. And then on Thursdays, we have periotherapy, where we have a lecture on an advanced concepts in perio. And for the clinic sessions, when I do transition to the clinic, I'll be in clinic on Mondays, Tuesdays, and Thursdays from 8 to 5. However, on Wednesdays and Fridays, we are only in clinic in the morning. So we get Wednesday and Friday afternoons off. And that time is to be used for research. So we also have to defend a thesis at the end of our program to get the master's degree. And so you have to be working on your research as well. And the time management that you have to have for yourself is tremendous, because nobody's going to hold your hand. Nobody's going to say, hey, you're missing this, or this assignment is due. We don't have a lot of exams. So it can be very easy to fall behind and say, oh, well, I just won't read this because I don't have an exam coming up. But you have to hold yourself accountable. But I will say that my program has a very positive outlook on work-life balance. I never really feel overwhelmed. We have vacation days that we can take if we need them. You just have to put your time in for it. And as long as you're not trying to take all 20 of your days at one time, it'll more than likely get approved. But you do have that time off, and they want you to make sure that you're still going to your doctor's appointments and keeping on top of your health and wellness. It's a good balance. It's busy, but it's doable.
All right, thank you, Dr. Wilkerson. So I was going to say, is it anything like Dr. Austin's gross anatomy?
No. So we only focus on head and neck. Gross anatomy was only 2 weeks, but we did have to go back to the dissection lab and dissect the head and neck. And that's just mainly because we'll be doing surgeries. And so they really want to make sure you know exactly where that greater palatine artery is. It's not like in dental school where you can kind of skate by it, if, whatever. So yeah, it's not like Dr. Austin's class, but it's not a cakewalk either.
Just a little background, Dr. Austin is Meharry Medical College gross anatomy professor, and she teaches usually the medical school and the dental school, but her exams are tough. It's hard to get through that class. That's why I was bringing that up.
No,
but, thank you.
And we didn't have a didactic exam for gross anatomy, just the clinical.
Oh, okay.
Mm-hmm.
Thank you for that.
You're welcome.
Up next, Dr. Scott. Sorry for the wait.
You see, I'm yawning now. But I will say, when you're applying to schools, ask the schools what they're focused in, or before you even apply, you should know, are they, more research-based or more clinical-based? For University of Florida, they're really clinically based. So, and right now I'm a second year, but, from when you get there, you have, maybe a month or two. Like the first years that are there now, they've been there maybe 2 months, and a lot of them have already got surgeries planned or have done surgeries already. So, and I think we talk about that a lot. The main reason for that is, our director believes that we should be learning as we do. And, also prepare. If you got a case coming up, a procedure coming up, whether you're working with pros, we work a lot with prosthodontics. We work a lot with endo. I get a lot of my cases from endo. So shout out to endo. But I think that you have to just prepare. And so at nighttime, I spend a lot of time preparing. During the day, it's 8 to 5. Now, actually with Zoom, they got a lot more access to us. So I have we have implant class. We have an implant center on campus, oral surgery department, the 4 and 6 year program. They're in the implant center. And so we have them, we have pros places, some implants, the implant center places implants, and perio places implants. So most mornings at 7, we'll have an implant course that everybody attends, that you could do Zoom or the class. Clinics start at 8. Wednesday mornings, we have lit reviews. Friday afternoons, we have case presentations. But during the day, it's packed with patients. So when I walk in the clinic from 8 o'clock, I have a patient, 9 o'clock, I have a patient. They pack in as many patients as possible So you don't really get a break during the day. Sometimes I'm finding out now that I'm losing a lot of lunches too, either with classes or trying to catch up from patients I saw this morning or cases that I'm trying to plan that I need to sit down and talk to the director with and order supplies. And, you know, you're responsible for every single aspect of the surgery. If you're doing a multiple implant surgery, you have to order all the parts. You have to order all, you know, you might have to sit in with pros and order all the prosthetic appliances. You know, you need to have all the materials. Everything needs to be done right away. Then you might have requests from the third year residents. They might want you to do things that you need to look at. You know, a lot of the technology that we have needs to be calibrated, whether it's the 3D printers or the scanners. All these things are done by first and sometimes second year. So there's, you know, your day is packed. So, you know, mainly the nighttime is really the only time you really have. And we have a couple days blocked out, but you also have classes. Most of the classes are in the afternoon after clinic, you know, from 5 to 6 or, you know, during lunchtime. So, I mean, you really have to kind of just manage out your time the best you can. Take advantage of opportunities. Really, you know, all the things we talked about that they look for in people when you're interviewing, those skills get tested. You know, fitting in with other people, working with other people, being able to ask another resident for help, being teachable, being self-motivated, understanding who you are as a person and your limitations and not jumping into things that you can't do, that you won't be successful. Because the patients, you know, at the end of all of this, everything we talk about at the very end, the patient is the one that's going to be hurt. You know, if you go into a surgery and you botch the surgery or anything you do, you know, at the end of it all is patient care. So just trying to be comprehensive and realizing that you can't complete every task. You just need to move through things and be as basically just try to stay on top of as much as you can, but realize you'll never get everything done.
Thank you for that, Dr. Scott. We have Dr. King.
Alrighty, for the pediatric dental specialty at Harlem Hospital Center, normally you'll do grand rounds on Monday at 7:30 a.m. and that's where the pediatric dental residents and the oral and maxillofacial surgery residents that are going to the operating room will present the cases they have. So they'll do the pre-op cases, meaning whatever they're going to do on that particular week, they present to the entire residency and attending staff. And then they'll also go over the post-op cases that were completed the previous week and go over any complications or anything that could have been done differently. So that's on Mondays at 7:30. And then after that, every other day, Tuesday through Friday, you'll have lecture from 8 to 9 a.m. And then you have clinics from 9 to 5 p.m. As far as how your work is done, it's more of a clinical program. And so your didactics are kind of done on your time outside of the clinic. So you get a syllabus at the beginning of the month that has all of your assignments. So we're heavy on the McDonald and Avery book, as well as a couple of others. You have your reference manual for pediatrics. You have your handbook, which is like the Bible of pediatrics. And that's where we'll all get assignments on what to read and you present it to each other. So that syllabus comes out at the beginning of the month. So you kind of know what's due and it's up to you for just getting things done before the particular date. As far as clinic, you're in there for 40 hours. You are on call with the hospital emergency room. So you see trauma, you work closely with the oral and maxillofacial surgery team. And so those on-call hours will either be after your clinic hours or it'll be on the weekend, however you're scheduled. Like Dr. Wilkerson said, you do get 20 vacation days throughout the year. With our program, you're expected to do 10 during the first part of the semester. So sometime between September and December, you wouldn't take them all at one time. So they're like 1 week breaks at a time. And then you'll do your other 2 weeks or your 10 days during the second part of the semester. You turn your vacation days in up front at the beginning of the semester or of the season. And outside of that, as far as our program, maintaining a good work-life balance, like I said, you know when everything's due. Our hospital, Harlem Hospital, is in Manhattan. You're close to the 2-3 train. And so there are restaurants up and down the street. There's Central Park, which is walking distance. There's lots to do. So it's up to you to kind of manage your time to do, you know, anything else that you might want to do outside of the clinic. to kind of maintain a life outside of the clinic.
Thank you. Thank you for that, Dr. King. We have Dr. Talalenko.
As far as my endo program, it's definitely more clinical based. I would say we're in clinic about 60 to 70% of the time. In the mornings, we have literature review from 8 to 9 or 10 sometimes, because if you want to become board certified, you do have to know a lot of literature, research articles. And as far as balancing residency, it's a little bit more easier to balance compared to dental school. You're not really studying for exams. There's no classes that you necessarily have to study for. So it's a little bit easier to balance compared to dental school.
Thank you for that, Dr. Talalenko. Up next, Dr. Martinez.
Okay, for ours, it's pretty much every day, 7:30 to like 5 or 5:30 in clinic. And some days we'll have the afternoons off for classes or lit reviews, but a lot of the times it's a lot of just working. And then we are also expected to have research component at some point, but I still need to find time for that one. So usually it's on the nights or the weekends, people will do research. But yeah, it's a very heavy on the clinic.
Thank you, Dr. Martinez. And lastly, Dr. Vincent.
For my GPR, we pretty much started at 8 o'clock and ended at 5 every day. Everyone's singing it ran over. From 8 to 9, most days we would have lecture. 12 to 1 was usually lunch. Sometimes we would have lecture again. And then usually you would have call. We would have call one day at a time, not necessarily 1 week at a time. So some programs will have it 1 week at a time. You just have to see which program you're applying to, how they do theirs. And then because programs are accredited by quota, there are different requirements that are basically needed for each program to remain accredited. So there's something called like grand rounds where you have presentations of your topic of choice. And then there's like little mini presentations and things that you have to do just to basically maintain accreditation. So it's kind of a way to keep up with your clinical learning as well as your didactic learning.
Thank you, Dr. Benson, and thank you to all the panelists for providing such key information, jewels that will take, dental students like myself into residency and successfully. But I want to open the floor up to questions. So if you could post your questions in the chat and make sure that you direct them to a specific panelist that you had in mind, or if it's just a general and I can pick. So we'll give you a few minutes to ask any questions.
Shireen, there is a question in the Q&A box from one of the attendees. I believe it's for Dr. Gallagher.
Just give me a moment. I'm trying to search for it now.
Can I just answer this in person? I'm gonna go for it quicker than typing, and it's more fluid. Basically,
you see it, Dr. Gallagher?
What's up?
Do you see it directed towards you?
Yeah. I'm gonna answer this. Is that all right? Or do you want me to type it?
Oh, no. You can speak. Yes.
Sure. So you can do multiple externships at the same program. However, the fact is that you want to try to I would get at least 3 in at different programs. You want to expand. The second thing, before I go back to answering your question, is that you really want to shoot for reach programs on your externships. You don't want to extern at safety programs, because if you already know you're going to get an interview there and you extern there for a week and you just happen to rub someone the wrong way, you just lost one interview. If it's a reach school and you don't expect to get an interview, I didn't expect to get an interview at NYU. I got lucky. I externed here and I came back for a second day, and I got lucky. You want to extern high up and maybe you'll get lucky, right? That's what we're all here for, but yes, if you really like the program, you extern there. It's a great idea to go back to that, and maybe a day or 2. You don't have to do a full week necessarily, but try and get at least 3 in at different programs.
Thank you, Dr. Gallagher. Any more questions? We probably have time for at least a few more. you want to throw them in the chat box and have our panelists answer them, it's your time.
Shireen, there are questions in the Q&A box.
Okay.
Okay, I see it. You have to go to open. Perfect.
Sure.
So we're going to go on to the ortho residents. Any panelist can answer, however, under the constraints of time. Whoever answers first gets to speak. They get the prize of speaking. And do most programs offer a stipend to help offset tuition? That's for any ortho resident that would like to speak up.
I don't know if it's for most programs. I do know there are several types of programs. There's the hospital-based program where there is either the stipend or, you do earn a salary, just similar to, to non-paid, to paid residents. Then there are the school-based, where I am at Stony Brook, it's a school-based institution. So we do pay tuition. And there are also different years. So there's the 2-year ortho residency or the 3-year ortho residencies that can also offset some costs. I don't know if there's a set number of how many are stipend versus non. If the other residents know more so, feel free to jump in.
No, I agree. I know of programs that offer stipends, and some of them will offset the tuition that the school-based programs have, but they're not significant. I think that is probably one of the things that probably is not the most fortunate about ortho residency, is that for the most part you're going to be paying tuition unless you end up at one of the hospital-based programs. And if they do provide a stipend, it's usually it's nominal.
With Harlem Hospital, I'll answer for all the pediatric dental program, the oral and maxillofacial surgery, as well as the general practice residency. They're all on salary, and they have something by the CIR now, which is the residency union, that allows residents to be paid an extra $200 for every on-call set of hours they work that's on hospital holidays.
Any other questions? I think something just came up. Just give me a second. Yeah, so student Dr. Janika James. She's asking Dr. King, would you recommend applying to residency during dental school or after completing dental school? How did practicing dentistry before entering pediatric residency benefit you?
I would recommend applying during dental school. If it's something you're interested in, apply right away. One of the things about doing externships or visiting programs can do to help you is it can allow you to see the programs that kind of prefer you have done a general practice residency first versus programs that are happy to have you fresh out of dental school. So if you're interested now, I would go on and apply now. For me, I visited as many programs as possible, and that was how I was kind of able to see certain programs tending to be a little bit more lenient towards students that were coming fresh out of school, and other programs were, had a good amount of participants that had either done a general practice residency first or had work experience first. So by visiting, you're able to kind of decipher and see for yourself, firsthand what the programs are looking for. So apply now, just know where you're applying. Like, you want to know your audience, you want to know your program. And you can reach out for more on the side. We could talk more as well.
Thank you very much. That was a great question. And we're going to be ending this panel discussion. Thank you to all the panelists. Of course, always thank you to our sponsors. But thank you, Dr. Vincent, Dr. Martinez, Dr. Talalenko, Dr. King, Dr. Scott, Dr. Wilkerson, Dr. Gallagher, Dr. Carter, Dr. Czar, and Dr. Thompson. And if, as far as getting in contact with you guys, it's okay to, for people to hop in your DMs and ask you a question or two. Is that okay?
Sounds good.
100%. DM's easy, allows you to filter through and you can answer questions very effective.
Exactly. And also check out Students of Dentistry and Elite Dentists, Dr. Czar and Dr. Gallagher. That's their organization. They do a lot of outreach to people who are trying to get into residency. They offer a lot of advice. They have a good following on social media, and other people as well, Dr. King and so many others. So just reach out to them. They're more than welcome to. They always like to give advice, and they're here for you. They're here for me, and they want to give back. So thank you very much to all the panelists, and that will conclude our dental professionals panel discussion.